Top biologist Dr. Anurag Agrawal is now joining us. He also is the head of the CSR's Institute of Genomics and Integrated Biology, and he is also heading the WHO advisory group that recommends on the variants of concern. Thank you so much for taking time out for us today. Dr. Agrawal, I want to begin by asking you, in terms of the total number of cases that India is reporting, how bad will things get from here on? Are we going to see a further surge in the number of cases in different pockets of the country?
Well, I think we're already starting to see surges in all parts of the country. Looking at the total number of cases is usually a not very meaningful exercise because it depends a lot upon who we test, how much we test. The more you test, the more cases you find. But what you can see from the cities that have already crossed the peak or are at the peak, that the burden of severe cases has not been unmanageable. I would use Mumbai and Delhi as the best examples. And extrapolating from that, you can say that similarly across the country, things should stay manageable, even as cases continue to rise in the next week or so.
So what is the estimate as to how many cases can India report in a day? You did say that it's a meaningless exercise to count the cases, but also we need to look at the overall caseload burden also, that the government is obviously counting the cases.
No, what I mean to say is it's meaningless to say exactly 5 or 6 or 7 or 8 or 4, because the true number of infections will always be far greater than the number of cases you report.
How much more, sir? If like India, for example, has reported 3.5 lakh cases, what could be the real numbers?
Well, historically, if you go by sero surveys, the counts tend to be multiple times, 2-3 times more than that. So I think we will pretty much hit the previous peak, even cross it in terms of total number of infections. But the actual number of cases might be close to the previous peak only, 4, 5, something like that. But like I said, that's not a very important number to me. The more important number is how many people are coming to hospitals, how many people are reaching ICU.
Deaths have increased in India. What is the reason? Is Omicron the reason? Is Delta the reason? What has the research found in terms of the genomic sequencing? Are you looking at samples of patients who are hospitalized and who died because of the infection?
Of course we are. And the answer is pretty straightforward. In December, we were still looking at mostly Delta. In January, we've been looking at mostly Omicron. In cities, it's almost all Omicron. Big cities like Delhi, Mumbai, it is almost all Omicron. In smaller parts of India, it is still Delta. And this is natural because Omicron started in the big cities and spread outwards. So it will take time to reach the rural, small places. And once Omicron reaches, it tends to, overtake Delta in a relatively short period of time. And Omicron has a huge advantage over Delta in any population that has a high level of immunity to Delta, either because of previous infection or because of vaccination. And India has both. So again, Omicron has a big advantage no matter where it goes, except for the remote parts.
In Delhi and Mumbai, for example, and other parts also, where the deaths are increasing, is it mostly because of Omicron?
So deaths happening now from infections in January are mostly Omicron. Deaths in early January because of infections in December were mostly Delta. At this point, the new deaths you are seeing from January infections are mostly Omicron.
Okay. So which means that the infection is still killing the comorbid, essentially, those who are most vulnerable.
Absolutely. So Omicron is very different from Delta in that it does not lead to, in healthy people, severe pneumonia, severe need for oxygen, ventilation, the way we saw in the Delta wave. However, it is not an innocuous common cold. In the right type of person who's unvaccinated or old or comorbid, it can certainly lead to death, usually by exacerbating the existing comorbidities.
Okay. So, how bad is the situation in terms of the peak getting over in Mumbai city, for example? A lot has been said that the worst in Bombay is over. What do you have to say?
Well, worst is always in 2-3 ways. So, for example, you can have a worst in terms of number of new cases. I think the worst is over indeed.
In Mumbai?
In Mumbai, yeah. I think the cases are on the way down. We have already crossed the peak over there. Even in Delhi, we have crossed the peak. But the surge in severe cases and deaths usually follows a bit later. And then, for example, in pediatric patients, there is something called MIS, multi-organ inflammatory syndromes, that can occur much later. So, but by and large, if we are speaking of acute new admissions, things filling up, that worst phase is over.
Okay. So now you're saying that in terms of the number of cases, the peak essentially is over in Delhi and Mumbai. But what one needs to be cautious about is MISC in children, and also that there could be more hospitalizations in terms of a fallout of the infection of so many weeks or so.
Okay. Yeah, so we may not see a decline in the hospitalizations and ICUs and deaths for some time. So in that sense, the worst is not over. And while there is no evidence in any of the global data of high amounts of MISC, we will only get to know, in due course of time. What I mean to say is you don't know it until the time for that has passed.
The Indian Council of Medical Research seems to be suggesting that by their own estimates, it's about 3 months or so that they expect the Omicron wave to last. And by that calculation, 11th of March is when they expect the Omicron variant to move towards endemicity. What's your understanding of the situation?
I generally don't like to predict with dates like 11th March, but I will say the following. I think ICMR is absolutely correct that Omicron will become dominant across the entire country in due course of time. In my opinion, it is already dominant when it's nearly 100% in the big metros. It is getting to be 90% plus in the small metros. It will certainly be very high even in tier 2 cities. And for example, in Rajasthan, Lucknow, you can already see it's pretty high. Rural areas are still going to be Delta at this point in time, but they will get replaced maybe another month or so. When it ends is going to be a difficult question to answer for anybody. How do you say wave has ended? You can say the peak would have passed sometime in February, latest. But ending depends upon, all the people who are previously protected, not in connections, so that tail can run longer as well. And when anything becomes endemic is, anybody's guess. Because there were talks about Delta becoming endemic, then Omicron came. It all depends on the next variant as well, right?
So the national peak of the Omicron wave will pass, the national peak will pass by the end of February. That's your estimate?
Before that. That. In my opinion, well before that.
So this, are we looking at like some 2 weeks or so? What is that you're looking at? So middle of February?
Yeah, I would say before middle of February, end of January, middle of February, the national peak should be clearly passed. But again, like I said, it depends so much upon testing. See, a national peak in itself doesn't have that much meaning. It's a buildup of multiple peaks occurring at different times in different parts of the country. Some parts test a lot, some parts test a little. A peak occurring in a part of the country that doesn't test doesn't contribute to the national peak at all. So it depends on a bunch of factors. But I certainly think that by the end of February, this entire surge of Omicron that we are seeing around the nation will mostly have been stabilized. And we will be looking at the tail end. And how that tail end will look is not known. How the next variant will come is not known. And
you also did mention that within a month's time, you'll see the surge in rural areas. Also, the infection will be replacing Delta in rural areas. Given that there are vulnerable people who are still dying and the kind of system, the healthcare system that we have in rural areas, do you fear that it's going to at least overwhelm the system in rural India, not so much in urban India, because overall the pressure hasn't been much?
I don't have much fear of that for a very simple reason. Immunity is very high. So if you were to take two simple facts into play, people say Omicron itself is milder than Delta, maybe somewhere between 60 to 80% milder in terms of risks of creating severe disease requiring hospitalization. And then you consider that prior infection or vaccination also gives you 80-90% protection. You add both of these things together and you see that situation is very different from the Delta wave. So number of cases will rise, including in the rural areas. But I see no reason that we will face any kind of problem that we faced in the Delta wave, because that's simply not how this virus is behaving. And we have a huge amount of immunity in India, including what is called hybrid immunity, where people are both infected and vaccinated.
Also, sir, you mentioned prevalence in metros like Delhi, for example. I want to ask you, like a state like Maharashtra, what's the kind of prevalence that you see? Which is the state which has seen over 90% prevalence?
See, Maharashtra is larger than many countries.
Mm.
So again, if we say Mumbai, it's a connected people, place. Maharashtra will have areas where people rarely travel to cities.
Mm-hmm.
So, a state that contains rural areas, backward areas, less connected areas, big metro, big cities, there is no point. Delhi as a state and Maharashtra as a state are two completely different things.
Mm-hmm.
So a lot of Maharashtra will still be Delta. The less connected part of Maharashtra will still be Delta.
Mm-hmm.
Which is again, there will be no single peak for Maharashtra. It will be a composite of multiple,
and Mumbai city?
multiple parts. Mumbai peak is already down. Mumbai.
What's the prevalence of Omicron?
Like I said, pretty much everything is Omicron by now.
Meaning almost 100%?
Yeah, 95% plus.
Okay. Okay. You did mention that Rajasthan, in fact, has touched almost 100% prevalence. That's also correct. Rural Rajasthan as well?
No, I would not know the numbers for rural Rajasthan. The numbers that have come out always come mostly out of cities.
Mm-hmm.
But Rajasthan is also pretty high. 100 is one of those numbers that can never be fully true. It just takes one case of Delta to disprove 100.
Sure.
So pretty much what I would say is finding a Delta sample is unusual now in Delhi, Mumbai, many parts of UP, many parts of Rajasthan. We don't see Delta when we look at the sequences. And that is it.
So how is that when we have over 20 lakh active cases, and you yourself are talking about how in major metropolitan cities, it's mostly Omicron. Why is that the government is saying there are just 9,000 cases of Omicron? Is there some time that has been taken to pick up genomic sequencing of these samples, and that backlog is what we're talking about?
No. I think people are misunderstanding what the government is saying. Government is saying we have 9,000 or whatever thousand sequenced cases of Omicron. There is no benefit nor required to keep on sequencing every case as Omicron once you know that it is mostly Omicron. See, for example, I know that Delhi is mostly Omicron. What's the point of sequencing every case to prove it's Omicron?
Okay.
So 9,000 are the sequenced cases of Omicron for which we can even tell sublineage to people, cases that India will contribute to the world's efforts in sequencing.
Okay.
Remaining can be assumed to be Omicron in Delhi. So in Delhi, for example, today we have 11,000 cases. You can be very certain that more than 10,000 or 10,500 of them are going to be Omicron.
Okay.
But we will not know that. We can assume that.
Okay. You're in a position to make the assumption today, given the spread of this infection, this particular variant.
Absolutely.
So what is, in your opinion, the reason behind countries like Europe, Spain is doing it, London is doing it, doing away with isolation, not making face coverings mandatory? What do you think of this move?
I am actually not. So if you look at who has done well in this pandemic and who has not done well in this pandemic, I would not look at Europe or UK as the best examples of who has done well. Look at Japan. Japan has been through Delta waves. Now it is going to go through Omicron. People are using masks regularly and properly. And a lot of Southeast Asia and the same things has kept it low. I personally think use of face coverings is a good idea in public spaces, particularly in public indoor spaces, in public transport. And I don't think face coverings are required when you're in your own car, you are in an outside area, you're in a park, in a non-congested outdoor setting. So sensible use of face covering is always good. And any country that is saying don't use face coverings in a metro, for example, is not understanding the way of controlling these things.
Okay, so essentially, you do not agree. Also, a lot is being said on whether we also should be looking at it this way. You're not even counting all the cases in the sense that even testing is not required, given that, what are you going to do with asymptomatic testing data when people are not getting affected in a big way? In that sense, a lot is being said about then why just not go out and end isolation, end these restrictions? At the end of the day, just move on. Is this not an opportunity? This is a mild variant.
So it's a nuanced statement. So, for example, the decision by Delhi government to stop the curfews and everything is a good decision, right? I mean, you need to get on with life. But using a face covering while in public transport or in a closed indoor space can still continue while getting on with life. Again, like I say, look at how Japan is doing it. They have never stopped. Tokyo has never really shut down. So, in fact, the more people use masks and other things sensibly, the more even crowded cities can stay open. So, I'm absolutely for opening schools and for getting on with life. These things are important.
All right.
I'm simply saying that masks can become a part of them in specific settings.
Yes. So, what is your opinion on the new testing strategy? I think I touched upon that, with that statement that I made. But there's some confusing signals that went out initially to the states where just no testing was being done, and we saw dip in cases that led to a lot of people believe that the pandemic is over.
So, between two ends of a pendulum swing, there is always a center. So, what the strategy meant was don't go crazy in testing everybody, tracing everybody, because you cannot contain. Everything has to have a purpose. Omicron cannot be contained by testing everybody and then putting everybody in isolation. But there are plenty of people and plenty of settings in which you need to know whether the person has disease or not. So if I were to take the example of my own house, if my 8-year-old mother even had mild symptoms, I would certainly test, because knowing that she is positive would help me plan a strategy properly. My young 18-year-old daughter who has asthma has a few coughs. I would not immediately run out to test her. It's winters. She is asthmatic. A few coughing is not abnormal for her. So there is a sensibility that you use in the middle, and it has not said don't test anybody. It said you can always take doctor's advice. But don't go around testing asymptomatic people for no reason.
Okay. So basically, the strategy of test, track, and isolate, that is something that has changed because this variant essentially has changed the course of this pandemic?
Yes, it has. So you don't go around and finding it with very aggressively in asymptomatic people, but you still try to make sure that people who are positive, symptomatic, coughing, sneezing, about those people.
So what about the mutations as far as this variant is concerned, and how worried should we be?
So if you look at the previous thing, a variant gets displaced by another variant that does not share a similar immunity. So there was a huge amount of panic over Delta Plus earlier, but ultimately Delta Plus did not do very much because Delta Plus was too similar to Delta. So immunity against Delta also worked on Delta sublineages.
Okay.
But Omicron was very different from Delta, and therefore immunity to Delta did not work against Omicron. So the next variant that will be able to displace and suddenly make a rise has to escape the immunity both to previously to Delta and to Omicron. So eventually, can such a mutant arise? Of course it can arise, but it'll take probably some time, like usual. And because immunity of the population is good, again, you would expect the next wave to be hopefully milder, unless the virus changes a lot.
Okay. All right. So my last question to you is that a lot is being said around boosters. What type of a vaccine do you think works very, very well as a booster, especially in the context of the Omicron variant?
So all over the world, you can see that the third dose of any vaccine is not giving you 90% type protection against infection. At most, you're getting 60-70% type of a protection against infection. And that is because all the vaccines are fundamentally designed towards the original version of the virus. Amongst them, the protein subunit vaccines is probably the best available option in India once the local data is generated, because right now we only have some foreign data for their use. Till then, third doses of the previous vaccines are probably the only available thing. And going forward, you assume that even vaccines will evolve to cover the variants.
So by protein subunits in India, what we have before us at least is Covovax, which is being developed, and Corbevax, both of them being manufactured in India.
Both manufactured.
That should be our best bet.
It is likely to be the best bet based on data it's only data for one of them, which is Covovax, also called Novavax, from the Curve Boost trial done in UK, in which the level of rise in antibodies and the level of rise in cellular immunity was almost 3 times greater than either inactivated vaccines or another dose of AstraZeneca. But like I said, that's one trial in UK on a particular group of people. If we were to base it on that, one would say Covax is the most promising candidate amongst the ones available today. But like I said, more data.
Okay. All right. Thank you so much, Dr. Agrawal. Thank you for your answer.
Bye-bye.
Bye.